I'm Dr. Scott Fuller. This show is hope, not fear. And let's get back to work. We'll talk about that as we go along here. First thing, stop flushing hand wipes down the toilet, right? Next is, when this coronavirus blows over, which it will, I hope that we shift our worldwide focus to climate change, the environment, and pollution. Some quotes. Spread calm as the contagion rather than fear. Let's let connection be the new infection, said Judson Brewer on Impact Theory with Tom Bilyeu, March 17th of 2020. You can look that up. Trish Whynot, a holistic counselor, wrote a blog post. The title of it is, Forgiveness is the Most Powerful Sanitizer. Great stuff, Trish. Tony Robbins on an Instagram post on March 11th. He stated, Warren Buffett teaches us, don't panic when others get scared by headlines. He also said, my mentor Jim Rohn taught me, every day stand guard at the door of your mind, which means be careful what you're feeding your mind every day. Be careful to have media stuff on all the time, and many of my patients have told me that too. Now, President Trump said this several days ago. We can't let the cure be worse than the problem, or don't let the cure be worse than the disease. I'm going to expand on that in a moment. There are some things that I don't agree with President Trump, most importantly, taking us out of the Paris Climate Agreement. But let's take a look at this one here. So, as we get back into trying to ramp up our economy and getting back to work, it makes sense, and we're going to talk about this in a moment, more of this, is shutting down hotspots in the country makes sense, but shutting down the entire economy for extended periods of time with no end in sight could really crater the economy, according to Peter Attia. And in just a moment, he said it that way. So some numbers, again, a little bit of perspective. I know that some people don't agree with comparing this coronavirus infection with flu viruses and so forth, but I still think the perspective is worthy. Johns Hopkins University, some statistics today, 657,000 worldwide cases of SARS-CoV-2, 30,000 deaths, 121,000 people identified as infected in the United States, 2,100 deaths. Massachusetts, where I am, 35,000 tests have been done, 4,200 cases, 44 deaths. Now that's interesting because that means that there are 35,000 people that were tested with symptoms. Out of that 35,000, 4,200 are coming up with coronavirus SARS-CoV-2 positive. All those other people are having symptoms, but it's not coronavirus. Interesting. Now, flu-wise, 1 billion cases per year worldwide of people that get sick. 10 to 45 million in the United States get sick with the flu each year. That's not people that go to the hospital, but that's people that get sick. Worldwide, there are 291 to 646,000 deaths per year by the flu. In the U.S., it's 12,000 to 61,000 flu deaths per year. Many of you are becoming aware of the statistics. This flu season in 2019 to 2020 in the United States, it's 23 to 55,000 deaths. Last year, it was 37,000. The year before that, 2 years ago, 61,000 people died of the flu, with hundreds of thousands of people requiring medical care and hospitalization. Mick Mulvaney, the acting White House chief of staff, said, in a quote, "The flu kills people. This coronavirus is not a death sentence," he said. March 22nd of 2020 on this website, arstechnical.com. It was an article written by Stephen Levy of Wired.com, and the title, "The Doctor Who Helped Us Defeat Smallpox Explains What's Coming," and that is Larry Brilliant. He says, to self-isolate and close schools, cancel events is right now, meaning the correct thing to do. Is it going to protect us completely? Is it going to make the world safe forever? No. It's a great thing because it's going to spread the disease out over time. By slowing it down, we're not going to decrease the total number of cases. Interesting. You're not protecting yourself permanently. It's just delaying the number of people that get sick all at once. We're going to postpone cases until we get a vaccine. The epidemiologist gold ring, which is A, enough quantity of us get the disease and become immune. I'm banking on that for most of us. And B, we get a vaccine. The combination of A plus B creates herd immunity, which is around 70 or 80%. Everyone needs to remember, he says, this is not a zombie apocalypse. It's not a mass extinction event. And most importantly, he says, we begin to see large numbers of people, in particular nurses, home health care providers, doctors, policemen, firemen, teachers who have had the disease, are immune. We've tested them to know they're not infectious any longer. And maybe we need to have a system that identifies them, either like a concert wristband or a card with a photograph on it and some kind of a stamp on it that says, I've been infected, I'm good, I'm clear, I'm healthy, I have my acquired immunity naturally by nature, and then we're comfortable sending our kids back to school with teachers that are not infectious. Anthony Fauci, the White House coronavirus task force doctor, a household name now, right? On March 22nd of 2020, he says, likely the coronavirus will come around again next season. So we're going to have to deal with this again. And we have to think about this as a community, as a country, as a world, how we're going to handle it moving forward. With flu and some other benign common coronaviruses, he says, when the weather gets warmer, there tends to be a downtick. People tend to spend more time outdoors, so it's less infectious. We know what's going to happen. We don't know what's going to happen with this virus because it's a unique one. Likely it's going to come around this season, and we might get a break with the weather, but it will give us time to prepare. So we have to understand what we're going to be doing as time goes along. Now, again, on Peter Attia's podcast, he interviewed Sam Harris on March 24th of 2020. Just keep in mind, if you do navigate your way there are a few, not many, but there are a few profane words on there. Just keep that in mind. As Peter Attia said once, between SARS-1, MERS, and SARS-CoV-2, which is the infectious agent with this coronavirus outbreak, it's not likely that coronaviruses are going away. So we just need to understand that, and the fear in these numbers, the number of coronavirus cases doubled in the last 24 hours. It's just simply we're getting more tests, and we're behind the eight ball here, and we were woefully not prepared in this country with enough tests and so forth. And Bill Gates said 4 or 5 years ago on his TED Talk that we need to be prepared for the next pandemic, and we weren't, and so forth. And here we are. Think of each city in the United States as its own country, says Peter Attia and Sam Harris. Consider shutdown of hotspots. Now that makes sense as we move forward. And he also said, well, the death rate's going to be somewhere between 1%, which it kind of is now, again, because we're just ramping up our testing, or 0.1%, 1/10 of 1%. That's a tenfold difference, he says. We don't know that yet until we get all these people tested. So again, the suggestion has been we need to do more like South Korea did and Hong Kong did and Singapore did, is ruthlessly test. If you're sick, you quarantine, and we're going to go after everybody you've been in contact with and quarantine all of them, but we're not going to necessarily shut down the entire country, and they didn't. And they have flattened the curve, but they did it with lots of testing and isolation and isolating any contacts that you had, and you just stay home for 2 weeks and so on and so forth, and that really worked. And maybe we do that now. Maybe we start going back to work. I'm just making that suggestion, and maybe that's not the right thing, but I think so. And if you can continue to work at home, you work at home. If you're sick, you stay home. If there's somebody in your household that's sick, you stay home. If you are caring for elderly or chronically ill, you stay home as best you can. And we as a community and a society support doctors, nurses, hospitals, long-term care facilities, nursing homes, and all of the support staff and janitors and everybody else involved. We support them with anything that they need: money, supplies. Maybe we pay for their child care. We're going to pay for their vacations when they can possibly take them after this is all. We take care of our heroes with whatever they need right now, but the rest of us trickle back to work with all of those other things in place so we don't crater the economy, the word that Peter Attia used. They're not necessarily agreeing doing that. They're saying maybe we need to shut down for 3 or 4 weeks to let this thing burn itself out. But then President Trump is making a point at what cost. So we need to balance that out. So our thoughts are now to slowly open the faucet to get back to work again with those those protocols for the vulnerable population in mind. But we need these protocols in place for the regular flu season in the vulnerable population because people die from the flu. Nursing homes, long-term care facilities, hospitals, doctors, nurses, and so forth, first responders, all of these protocols in place. And if we're sick, we don't visit our grandparents and so forth, right? So wrapping up, what do we do? Number one, healthy nutrition. Now that we're stuck at home with the kids, bring the kids into the kitchen, help them start learning food, preparing meals. That's part of their homeschooling right now, is healthy nutrition and how to cook and prepare. Number two, exercise. All of my patients that are still coming into my chiropractic office, and I'm doing my duty, I'm still going into my chiropractic office with safe protocols. If you're sick, stay home. If somebody around you is sick, stay home. If you're at risk, stay home. If you're caring for the elderly or chronically ill, also stay home. But we're taking care of the other people to divert anybody needing, otherwise it would go to a hospital for neuromusculoskeletal conditions that we can handle, or that will go to the doctor or the nurse or the urgent care. We're diverting that to take those people away from the life-saving procedures that are so critical at this point. So with that, you're stuck at home, people are doing a lot of working at home. I make the suggestion, get out for 3 walks per day. Walk 10 minutes 3 times a day. Take a longer walk if you want to. Work out with the kids. Number 3, take care of your spine and nervous system. If you can come into your chiropractor to continue that makes sense. Obviously following the protocols. If you're sick, stay home and so forth. Taking care of your spine at home, go get my book, Happy Back. Get the Kindle version. Get the book. If you already have it, pull it out. It talks about all these home care things that you can be doing to protect your spine. You should be doing that in addition to your chiropractic care, stretching your spine every day. Go to my YouTube page, learn the videos, get the book, and so forth. One of the best books ever written, in my opinion. Number 4, lots of water. Monitor your water intake. I have a little checklist. Every time I drink a 12-ounce glass, I cross it off to make sure I get to that 75-ounce threshold for me. So do that. Number 5, decreasing your stress. There are great apps and videos and books and things that you can read and little things that you can do throughout the day to keep yourself meditating and mindful and so forth. Lots of things. And I'll be doing some shows on that down the road. And making sure you're taking your immune system boosting supplements and sleep. Please, although we're stuck at home, try to get to bed at the same time. Try to get up at the same time. And these things will help you. And lastly, don't flush hand wipes down the toilet. I'm Dr. Scott Fuller.